It's a pandemic within a pandemic. Yes, India is actually fighting three things simultaneously. One is COVID-19, the second is black fungus, and the third, white fungus. So let's look at these in detail. Black fungus infection has actually taken over at least half a dozen of states in India. However, there are debates as to how the infection has actually taken over, what are the causes, and how can this be controlled, and whether this can be declared as an epidemic or a pandemic. But leaving all those controversies aside, let us look at how somebody could catch a black fungus. Primarily, a fungal spore floating in the environment give people this infection, which means that this infection is from the environment, meaning the place where we live. So once the infection catches us, it can enter our skin through a cut or through a sore or a wound or maybe a burn or a kind of a skin inflammation. So that small gap is enough for this particular fungus to enter. And once it enters, it plays havoc. It tries to erode many organs in our body. This is actually caused by being exposed to something called as the mucomold, which is found predominantly in soil, plants, manure, decaying vegetables, decaying leaves, fruits, etc. This infection is liable to take over anybody. It's not that particular age group or particular set of people will be attacked. However, there are some possibilities that people with diabetes, organ transplant, liver disease, kidney disease, cancer patients, that these people are more prone to this fungal infection simply because their immunity would be less. So they would not have that defense mechanism to fight this infection. So people who are of this category need to be extra careful. So let's look at what are the symptoms, or rather how this fungal reacts once it enters our body. It provides local pain on the cheekbones and maybe one side facial swelling or numbness, or sometimes even discoloration of the skin can be taken as one symptom. Next is loosening of teeth and jaw. You feel, difficulty in jaw movement. You have blurred or double vision. You have pain in your eyes, swelling in eyes, change in the color of your skin, of your eye particularly, chest pain, difficulty in breathing. These are all, some symptoms which you can immediately pay attention to and go for a treatment. According to the reports, various hospitals in India are treating this fungal infection. However, doctors suggest that the only guaranteed solution to cut it out or to put an end to this infection is to completely scoop the area which is infected. For example, if your eye is infected, they have no choice but to just scoop it out to prevent it from spreading further. So the matter is quite serious, and we need to be extra careful